Assalamualaikum warahmatullahi wabarakatuh. In this video, we will explain on the factors causing domestic violence during COVID-19 pandemic and measures to help the victims based on the analysis of 4 articles that we have chosen.
Hi, my name is Nur Afika binti Arman.
Hi, my name is Nordini Alia.
Hi, my name is Nur Anisa binti Omar.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Syahada.
The aims of this article are to identify the factor causing domestic violence to increase during the pandemic and how to help the victim. Domestic violence is a violence or other abuse in a domestic setting, such as in marriage or cohabitation. It is committed by a spouse or partner in an intimate relationship against the other spouse or partner. Domestic violence also involves violence against children, teenagers, parents, or the elderly. It takes numbers of forms of violence, including physical, verbal, emotional, religion, reproductive, and sexual abuse. 4 articles that is used is firstly, urgency for distancing from domestic violence. Second, a pandemic within a pandemic, intimate partner violence during COVID-19. Third, pandemics and violence against women and children and domestic violence. And lastly, the safety of women during the COVID-19 pandemic. We will go to the factor why the domestic violence increased during the pandemic. Firstly, stress due to the pandemic has increased the case of domestic violence. Stress is a feeling of emotional or physical tension. It can come from any event or thoughts that make an individual feel frustrated, fierce, angry, or nervous. According to Brooke et al. 2020, in a recent systematic studies says that quarantine gives a negative psychological effect towards an individual. The symptom that can be seen is post-traumatic stress, confusion, and rage. This stress and confusion happen because of quarantine make them separate from the loved one, loss of freedom, uncertainty over the disease status, fake rumors regarding the disease, boredom, and many more. Not only that, as stated by Molinix et al. 2019, Robinson et al. 2020, and Sedili et al. 2019, there is a study focusing on the impact of humanitarian crisis and natural disaster on domestic violence, have shown that the stress associated with these emergencies lead to an increase in domestic violence. In contrast with the pandemic, we face almost the same situation as natural disaster, as it will affect the economy, loss of loved one, rise uncertainty, as we cannot predict what will happen next. Either situation will become normal or it will become worse. Next, Uitm et al. 2020 stated that the effect of this pandemic toward the economic, social, and psychological will induce stress that could increase the risk of domestic violence. This pandemic has affected day-to-day life and slowing down the global economy, be added with less social interaction between one and another that can lead to psychological problem and can add more stress to an individual. Lastly, according to the Pavli 2020, closure of school and childcare facilities have added to the stress at home. This is because virtual learning often requires involvement and supervision from parents and guardians. Some parents are considered an essential worker and cannot work from home, and some other parents are required to work virtually. The added of stress to balancing the work, childcare, and children education has led to the rise of domestic violence. Next factor is economic hardship urge domestic violence to happen. Economic hardship is defined as the inability to meet reasonable basic living expenses because of minimum resources or income. According to the United Nations Department of Economic and Social Affairs 2020, the COVID-19 pandemic has led to the greater level of financial insecurity, fears, and social pressure. Thus, according to COCHAR 2020, massive layoff and unemployment have escalated the financial entanglement. To make it clear, this pandemic has worsened the financial instability by causing increase of job loss and unemployment, especially to this group such as women of color, immigrant and worker without college educations. Lastly, according to the Peterman et al. 2020, the economic instability can contribute to the significant increase in likely of occurrence and prevalence of domestic violence. As we know, this pandemic has given a very bad impact to the economy in the world as all of the business are asked to be closed and work from home. All of the project has to be postponed until the condition is getting better. All of these decisions that been made can curb the virus from spreading, but it will give a bad impact toward the society as some of them will lose a job, salary has to be deducted, or to be asked to take unpaid leave. That will be resulting to the economic instability, financial instability, and fears as how they are going to survive and buy necessary things such as food, water, pay bills, and many more. This economic hardship that abusers face will lead to more domestic violence to happen as they face more pressure. Be added with the lockdown measure, the abuser will target his or her partner or children to vent their anger.
The third factor causing domestic violence during the pandemic is a bad home environment that lead to conflict between the family members. According to Uitm et al. 2020, they support that with the usual daily occupations of most individuals have changed due to the introduction of lockdown. Many employees has been retrenched, laid off, and told to work from home and closing of schools. Other than that, Uitm et al. 2020 also point out that spending more time with the family members in the same environment could increase the likelihood of dispute and could be a trigger for violent behavior. Thus, for those living in low-income and crowded households without the open space, it may increase the probability with domestic violence posed by COVID-19. Lastly, Campbell 2020 found that many child welfare organizations around the world are noted that a significant drop in report of child abuse or neglected by their family during the pandemic of COVID-19. Some of the family members has been dismissed from their works and it may lead to the financial problem during the pandemic of COVID-19 because they do not have money to support their family and they will start to abuse their family members when they did not find the solution. The fourth factor causing domestic violence during the pandemic is the victim unable to seek help as they live together with abuser. According to Uitm et al. 2020, they say that domestic abuse victim might be quarantined with an abusive partner, making it extremely difficult or impossible to ask for help and escape from the abusive relationship. Next, from the same author, Uitm et al. 2020, research revealed that by isolating victims from their families, friends, and society, lockdown intervention has raised the risk of domestic abuse. Thus, this situation has raised problems to leave home and to access the internet could restrict the opportunities for a victim to seek help without alerting the abuser. Lastly, according to Megan et al. 2020, believe that to protect the public and avoid mass illness, stay-at-home orders had many victims of intimate partner violence stopped by their spouse. Usually, someone do not know if their partner is an abuser until they will stay with their partner in a longer time and the partner will start to show the true color. For example, is during a total lockdown of COVID-19, they always be a victim of their partner to release the stress that has been faced by the partner if have a problem with financial or with the works. the partner will start to abuse the victim until they will feel satisfied with what they do. Not everyone is lucky to have a good partner in their life. The victim should tell their family or their close friends about their problems. It can lead to the mental illness or depression if they always be a victim by the abuser. Other than that, they also can consult with the counseling.
Next, I'm going to explain on the effort that can be taken to help the victims. First and foremost, we need to identify on how to prevent domestic violence from happening. In Malaysia, the Penang state government had announced an allocation of 100,000 ringgit for the effort to curb this issue and to support the survivors. The funds will be distributed to NGOs working on prevention of domestic violence, for raising awareness and to increase the availability of support services. Jong 2020 has mentioned that Penang Women's Development Corporation (PWDC) has organized a campaign annually to give awareness for the elimination of domestic violence while involving programs of available helplines for people to get know about the campaign. Uitm Seremban 2020 also added that this campaign should be held through platforms like mass media, social media and television to increase the attention toward this crisis as well as to give pressure on the authorities so that further action is taken. Furthermore, these campaigns are also a beneficial way to show the victim that help and support are still available and to inform the public that the sentence or punishment for abusers still apply.
Lastly, Uitm Seremban 2020 stated that the precautionary action for domestic violence should include helpline services that are free of charge and easily accessible at all times.
The next point is Ministry of Health must ensure that domestic violence is integrated into the health system response. According to WHO, health system response aims to raise awareness on the issue on how people are treated and the environment in which they are treated. Firstly, Uitm Seremban 2020 stated that the minimum care guidelines should be followed to ensure that the health system is in order and emergency responders are trained to handle domestic violence cases in this pandemic situation. Other than that, according to Uitm Seremban 2020, healthcare providers should be trained to detect women at risk of abuse in health testing and screening, and also ensuring that the self-quarantine is followed by a safety evaluation. They also mentioned that the physical observation and inspection, such as the action of a patient before or throughout the examination of physically intimate parts or an aggressive partner, can be warning signs of potential domestic violence. The victims might show signs such as multiple bruising, burns, low self-esteem or any sign of depression, while the abuser might indicate rough and controlling behavior.
And the last one is Uitm Seremban 2020 and Uitm Seremban 2020 have suggested that the healthcare services should focus on the victims with high quality reproductive health service and also connect with social service to give them counseling.
Now we move to the point 7, which is the allocation of financial aid by the government that can help the victims. So to support my point, I support with the supporting details that I took based on article that I read, which is the domestic violence and the safety of women during the COVID-19 pandemic, that was written by Yong Pei Jung and was published on 25 April 2020. So, Jong said that the financial support can be given to victims because it will provide them for their economic stability, as this will bring them economic relief as they navigate the next steps in their life. The financial aid should be easily accessible to the survivors with minimal red tape and constraints. Okay, next, according to Jung, there are notable percentage of domestic violence where the victims are depending on their financial status with the abuser and they may have difficulty maintaining the cost of living because they may be unemployed or their income may get disrupted due to the pandemic impact. So, according to Bastakli earlier at 2016 on article Pandemic and Violence Against Women and Children, they said that analysis of pathways and a large body of supporting evidence confirms that increases in economic security and reductions in poverty-related stress and conflict are the key mechanisms for impacts within cash transfer programming. Financial support facilitating the interventions such as cash transfer to ensure social safety nets for vulnerable populations, expanding support for survivors of violence, and donor institutions can contribute to limit the extent of harm caused by the pandemics. Okay, lastly, to support my point is by quote of Evans et al. 2020 in article Intimate Partner Violence. Financial problems with an abusive partner are too difficult to handle if the victim does not have another alternative source of financial economic support. This is because the pandemic has exacerbated financial entanglement by causing increased job loss and unemployment. Okay, lastly, for point 8 is the initiative by the government and NGO to support the domestic violence victims. So some supporting details that can support my point is by government agencies and NGOs such as Women's Centers for Change WCC, Women's Aid Organisation WAO, and Sneham Malaysia need to be widely published to citizens, especially in rural areas where information is more difficult to obtain. This was cited by June 2020 in the article of Domestic Violence and the Safety Women during the COVID-19 pandemic that was published on 25 April 2020. Next, Jung also said that helplines such as Befrienders, Talian Kasih and Telenisa can act as the main key for victims to seek help and emotional support. For example, Talian Kasih, a national hotline managed by the Ministry of Women, Family and Community Development (MWCFD), is to provide emotional support, received a 57 increase in calls between 18 to 26 March 2020 due to pandemic. Furthermore, according to Jong, the government of NGOs should offer skills training for the domestic violence survivors who are housewives or unemployed so that it will be the beneficial parts of assistance to add up their capacity to become financially self-sufficient after leaving the abusive relationship. Lastly, Jong has mentioned that government and NGOs may collaborate with the accommodation services provider to make safe shelters accessible to victims of domestic violence at a cost that may be partially subsidized by the government. It is vital that a supportive environment be constructed for the survivors to share their experience and their journey and to know that they are not alone. As a conclusion, the COVID-19 pandemic had certainly shifted the world's axis. For most people, staying at home is the safest place measure that one could take. However, for the sufferers of domestic abuse, the safest place to have also become the most dangerous place to be. It is essential that they are not forgotten and their needs not ignored in this time of uncertainty. Help and assistance by allocating financial aid by government need to be provided to them in a timely manner and to hear the survivors speak about their experience. The government and NGOs also need to play a role to victims that suffer domestic abuse so that they may be encouraged to seek the help they need.